Good morning. My name is Dr. Cephas Archie, and I am the Chief Equity Officer for the City of Rochester. And I'm here today to offer some additional thoughts, additional updates on our current efforts for testing in partnership with Monroe County in response to the orange categorical rating for the County of Monroe. We have been working diligently, if you would, for the past week to make sure that we are partnering with the Rochester City School District, the RTS transit system, and many of our local partners and community organizations who have come together collaboratively to help us develop testing structures throughout the city. And I'm here today to provide some feedback, some updates, and any answers that I can to questions that will help better prepare and communicate these critical resource needs and efforts for the City of Rochester residents and community members. Having said that, at this point of time, I will go ahead on and open it up to any questions that may be asked. And to the best of my ability, I want to make sure that we are providing clear communication and transparency on what we are doing and how we are doing it, and making sure that our residents are available and knowledgeable of what we are doing. So at this time, I open it up for questions.
Great, thank you, Dr. Archie. Our first question will be from Patty Singer at the Minority Reporter, and then Patty will potentially have a follow-up. Patty?
Okay, thank you. Is there a numbers goal for this, the target that you would like to see, and also maybe even have that broken down by ages, since the schools aren't open, so the young people can't be tested in schools?
So we're working in partnership with Monroe County based on what available testing data that they're providing to us. Specifically, Monroe County and the state are providing us with the actual tests. The first pickup of the actual test that was provided to us, which was this past Monday, was about 4,100 tests. And so as far as what we're going to be able to do in the immediate need or the immediate short-term time frame, there are 4,100 tests that we're going to be dividing equitably amongst our 4 sites. So that's pretty much about 1,100 tests per site that we're developing with the 4 high schools that we are going to be using as our testing sites. And so that is that first batch of tests that we've received. What we do know is that we developed and launched our scheduling where people could actually register for a specific site at a specific date and a specific time, which was created in partnership with the county. We're very grateful for that. And as of just yesterday evening, for the site that is open for this weekend, we are nearly at that 200 mark of people already registered within the first 24 hours. So we are expecting at least that population or that number for this Saturday for East. And again, this is the critical nature of us having a registration component for as much as we can. What we do know is that there are many populations or many persons or many residents who may not have access to do the registration, and we don't want that to be a barrier for people coming out. But we are strongly advising those who do have that access and that resource to do so, so that we can best be equipped and prepared to be able to respond to all of the needs of the people that as they arrive to the testing sites.
So my follow-up would go beyond that. So are there talks about how a vaccine would be distributed? And is this testing set up kind of a preview for how vaccine would be distributed in the city?
So one of the things that we talked about in the first round of the testing effort, which was about a month and a half ago, many of you are aware that the city, the Real Race Equity and Leadership Rapid Response Team facilitated the testing and the flu vaccination opportunity throughout the churches with our faith-based communities, which was highly successful. We wanted to let that be a precursor for what our efforts would be for the vaccination distribution. But what we wanted to actually roll out now is that this second effort with the county is actually building upon that first effort that we had with the faith centers and the communities that were here. And so we have already engaged the county working with the Real Rapid Response Team specifically for the forthcoming vaccination distribution that will be critical for not only our general population, but more critical to our most vulnerable populations. And so we are working in tandem with them to review that plan to make sure that these efforts build upon some of that work that was already initiated for that first sort of rollout of the testing centers with the Real team, as well as now building on that with the current effort with the schools. So there will be that intentional seamless efficiency in using these structures to help really bring that to fruition. So yes.
All right. Thanks. I may have some others at the end, Justin, if other people haven't asked them. Thank you.
Sure. You're very welcome.
Thank you, Patty. Our next question will come from Gino at the City Newspaper. Gino?
Yeah, thank you. So my understanding is this testing, this rapid testing is going to be available through the month of December. Is there any plan beyond that right now through January or February or into the spring?
What we do know, and good morning, Gino. What we do know is that this is an ever-evolving situation. So in our initial preliminary discussions, it was for the time frame, as you stated, up to the new year. Recognizing that our schools are looking to open, our RCSD City School District schools are looking to open for the upcoming January semester. And a part of their structures and operations per state mandates will be to regularly have testing operations in place for their schools respectively. And so what we have done and what we are in the midst of doing now is to continue to discuss with them to learn how the city and the county could help even support their efforts going forward for their specific city school district personnel, but as well as offering these very same resources for community members that are maybe not a part of the schools. So we are expanding on our initial plan, which was clean through from this time now through the beginning of the new year, but we're building on that now, literally getting staffing, personnel, structures, organizations together so that we do have the infrastructure to actually go beyond what we initially said, which was the new year. So yes, those planning efforts are in place now, and it is our target to keep these efforts going beyond the January timeframe that we initially had thought it would be.
Yeah, and my follow-up is more in a general scope of things. We all knew there was going to be another wave coming that we're now in right now. We all expected that. And I think there's a concern that people would be so fatigued that they wouldn't follow guidelines anymore and just kind of shrug it off. And I think we're at there right now compared to April. I see a lot more people out and about, a lot less people wearing masks correctly, doing the things they're supposed to do. What role do you think the city can play in getting people to actually adhere to those guidelines and do what needs to be done?
Well, one of the things that I absolutely agree with you that we are in that moment where we are in the second surge and we were planning for it. We were doing our best to prepare. And so one of the efforts of the first component of being able to sort of keep the curve flattened or at least at a manageable level was to make sure that we were increasing testing efforts before. So working with the county before this opportunity, working with the county to put on the testing efforts and the prevention efforts and the education efforts, the resources and supports with the county before now, so that when we knew the second inevitable surge was coming, we had done our due diligence to actually prevent it to the best of our ability. Obviously, these are things that are beyond our control, but we wanted to make sure we were ahead of the curve with said resources. You are absolutely correct. This is something that we want to make sure that we are encouraging all families, not just within the Rochester area only, but in Monroe County as a whole, as many of our constituents intersect interchangeably, to really remain vigilant. Remain vigilant in our efforts. We understand that the fatigue is real, and we that the isolation takes a toll on us physically and psychologically. But we do want to make sure that it is communicated clear from the city that it is our priority to keep us safe. And so with that, we are working even now with the REAL initiative. I know that the mayor announced it initially last week as a prerequisite that we're developing sort of a program for the COVID-19 preparedness plan, which really gets us to start thinking about the strategic and core essential needs that we're going to be asking every person and every family within the city, but also the county, because we want to make sure that we are protecting all people, partnering with the county to develop out this this preparedness plan, which allows us to think of all of the variables for prevention, all of the variables for if COVID comes and knocks at your door. Are you prepared? Is your family prepared? Is there a specific location in the house that's identified as quarantine? Is there a specific restroom? What if that restroom, or what if some of us don't have the privilege of having multiple restrooms? And so how will we put in procedures and protocols in place that confirm that we are disinfecting that one restroom that may need to be shared by other people who may not be positive for COVID. Again, looking at all of these strategies that are critical to making sure that we are preparing Rochester for this second wave and getting us through it. And so this is where we're not only looking at the now, but we're looking at the future, as well as we're looking at the long-term plan, which is the vaccination strategy, and how are we becoming a core component of helping to facilitate the success of that being rolled out as well.
Thank you.
Mm-hmm.
Gino, thanks. Our next questions will come from Emily at Channel 10. Emily?
Good morning, and thank you, Dr. Archie, for taking the time to talk with us today.
Good morning, Emily.
I'm curious, how will the city ensure that these tests are going to city residents? In other words, how will the city prevent people from the suburbs from coming in to test in the city once their tests are filled up? Will test seekers be required to provide proof of residence?
So as all procedures, and first off, Emily, this is a great question. So one of the things that we've done first off is that the tests that are being facilitated by the city in partnership with the county and the city school district specifically will be held at 4 different quadrants that are specifically in the city periphery, so that we want to make sure we're making these tests specifically available to Rochester residents, but also in the communities where these Rochester residents are, making it accessible. One of the things that we're doing as far as that accessibility, as well as working with the transit system, RTS, who is going to be developing specific free of charge transport options to and fro from these testing sites, so that again, we are making them for Rochester specifically, so that we're providing the access to the people who need it most. And so that's a commitment that we've made, and we want to stay firm on that. One of the things that we are working with per this structure as well, as stated, is with the partnership with the county, is that the county has allowed each of these, our neighboring sort of towns, Irondequoit, Brighton, etc., to develop their own testing options as well. And so these smaller towns that are affiliated on the outside of the city actual limits still have the exact same access to tests. They have their own procedures and protocols that they have in place, that the county is also providing them with staff and the actual supplies to actually facilitate the testing in their areas as well. What we are clearly aware of is that the city of Rochester is the largest area of Monroe County. And so this is where in different, or in contrast from the neighboring towns that may have 1 testing site, we as the largest entity of the county will have 4. And our testing dates and our testing times will be a lot more expansive than those towns, as the need will be in the city a lot more comprehensive. But to answer your question, yes, per the protocols from the Department of Health, as they have established the procedures and protocols for testing, an ID and those resources, are those critical identification items, will be collected as they are arriving for test as a part of the procedure for testing.
Thank you very much.
You're very welcome, Emily.
Emily, did you have a follow-up?
I do have a follow-up. I'm curious, the focus for these tests was asymptomatic people. I'm curious, if someone shows up with symptoms, will they be turned away, or will they still be tested?
Emily, no one will be turned away from a test, just to be clear. And that's because although we do want to highlight what our asymptomatic numbers are, we still do not want to make it a message of ours at any level that our priority is still not to accurately assess where we are when it comes to our positive and negative cases. And so no personnel, whether they are asymptomatic or symptomatic, will be turned away from testing. There may be additional steps that may be put in place for that person to have a specific waiting location, or their car to be in a specific area because they have identified as symptomatic, but we will not turn a person away because they are symptomatic.
Thank you, Emily. We'll move on to Brianna at Spectrum. Brianna.
Hi, good morning.
Good morning.
So yeah, my question is, with both having people to register and the option for people to walk up, I was wondering how exactly that would be managed if, let's say, all of the registration slots are taken.
So we're in the process of having a logistics team where we have both full-time staff that are being hired by the county, as well as volunteer staff, a mixture of both, that will be able to help us to delineate these specific sort of processes and steps for both. What we want to do is to say, so that we can plan ahead of time, and accordingly, we want to make sure that we are pushing as many people as we can to get to the actual pre-registration option. For those that are not able to, you can actually still register on site. That registration timeline may have you to wait a little bit longer, and we intentionally want to avoid that, not to have people sitting for or standing or stalled at one specific point in time, because we want to keep things flowing appropriately so that we can keep additional exposure down. So although it's not our ideal or preferred method, we will not turn someone away because they have not registered, and we'll be able to provide those resources on site to do so. And so that's very deliberate, intentional, and how we're trying to roll this out.
All right, and then my follow-up question is, we know that the virus has hit poor communities and Black and Brown communities the worst, and these testing sites still require people to come on their own accord. So I was wondering if the city has done any outreach of going into those communities to make sure they get tested, even if they are maybe asymptomatic, or how that would work.
So we have been developing those types of strategies, and that's, first off, another good question, before we started with the current second wave, specifically going into the churches, communities where these specific populations are in more dense areas. And so this is our effort to make sure that, and as this effort we're doing with this time, we're offering test free now, the same way that we offered test-free then. In addition, prior to with the initiative we had before with the faith communities, we also were able to provide free flu vaccinations as well. And that's specifically looking at the needs that you have just addressed. Now, having said that, per the real rapid response team as well, we've also developed sort of structures and protocols in place where organizations or people are able to reach out to us and request our ability to go into their area to test. I know that Dr. Clark and Dr. Mayo currently lead the Real Rapid Response Team's testing and treatment group, and they have been receiving requests and are also going to be, over the next month, 2 months, looking at specific concentrated areas of the city where they will be potentially bringing the test to those areas. So I know we got an initial request as of yesterday from an elderly community who specifically requested supports and need of tests. And so this is where we're going to be mobilizing components of the Real Rapid Response Team to see if our current efforts can support them by actually having testing operations being provided to them where they are. So absolutely, we're committed to continuing that, but I would be remiss if I wouldn't articulate that we were doing that even before the second surge had hit.
Thank you.
You're welcome.
Our next question will come from Kayla, Channel 8. Kayla.
Good morning, Dr. Archie. So according to the release, it says residents would be notified within 72 hours if they're negative, and they would hear within 20 minutes if they're positive. So if someone doesn't hear in those 20 minutes, do they assume they're negative? Should they isolate while they wait for a response just to be safe?
So the test, so you are correct. The test that we have in place will get response within 15 minutes. It's a different test than the nasal swab that was done before, and these more rapid tests will allow us to be able to know results quickly. As we want to make sure that we are responding in a time-sensitive manner, particularly to those persons that unfortunately may come back positive, we want to be expedient with that. So that information will be followed up with them, as well as the Department of Health has their protocols that they have in place, such as contact tracing, providing information about what next steps are for anyone who has tested positive specifically, because clearly we don't want to unintentionally have opportunities that, you know, the person isn't notified and is potentially spreading the virus to other people. So that is something that we wanted to make sure that we were apprised of. Your specific question was around notification. So that's where the notification of those that are positive. it says they will be notified up to 72 hours. Our goal is to get them notified, even the negatives, before that 72 hours. But we know that there is going to be a high volume of people that are going to be coming and getting tested every day. And so we want to make sure that we give ourselves a real a clear window, a fair window of how quickly we can respond. But for those that do test negative, they will be contacted by then. But those that are positive, again, I also want to reiterate, we will immediately implement and follow through with the department's health protocols that are having in place regarding notification, as well as contact tracing and support efforts that go forward from that point.
Thank you. And then my follow-up, we've seen some independent reports indicate that rapid tests maybe aren't as accurate as the traditional nasal swab. So is there a concern that there could be a false sense of security if somebody gets a rapid negative and just kind of goes about their lives without following precautions? I mean, what would your message be, I guess?
So if in an ideal world, if we had the resources and the staffing and the availability to do the more comprehensive tests, we would absolutely follow through with that request as a best practice. But utilizing the availability of resources that have been provided to us, and for the most part, they have in some part been pretty reliable. What I would say is that just because you come get a test on one day does not mean that we don't recommend you come back and get another test the following week or the next few days, so that we are communicating that it's not this one time, you don't ever have to come back. Which also is critical to why we stated we didn't want to just do 1 day a week of testing or one site or one location. We were very intentional with our current strategy or our current timeline of having it be Monday, Tuesday, and Wednesday, 3 days back to back, so that we are allowing people to come at different dates, at different sites, at different times, as well as adding that additional Saturday for any additional people who were, employed and still working throughout the week, who still needed to make sure that they brought in themselves as well as family members, et cetera, for testing options. And so we do acknowledge that there is that limitation of, the best practice of having the more comprehensive tests, but with what we have found and what's been recommended by Dr. Mendoza here with the county is that this is an efficient manner to get the outcomes that we're looking for.
Thank you.
Mm-hmm. Thanks, Kayla. Our next questions will come from Jane at Channel 13. Jane?
Hello, I was wondering if you think that 4,000 tests, is that enough for the city, enough for all of the residents who want to get tested?
I do say that for this first week, we project that it will be long term or even past that time frame within the next 3 to 4 weeks. I don't think that is an amount. And what I do appreciate is that the Department of Health, Dr. Lucas, Dr. Velez de Brown have all committed to saying as they receive tests, the city will be one of those first stops to make sure that we are re-staffed with all of the resources that we need, the supplies, that we need to make sure that the city is prepared to be able to operationalize the request and the partnership that they have asked of us.
And in terms of questions about equity, the efforts putting into the city, are they the same as the other places that are having rapid tested? Do you feel like the people are being served the same?
So what I do know is that at our table, at our nightly meetings, at our discussions and our community agencies and partners that we have all there, we have made sure that first off, we want to make and have it be confirmed that the very same resources that we are needing and that the towns are needing are equitably distributed to all. And so one of the things that has been provided as a support system is that the exact same staffing model that has been implemented throughout the towns outside of the city, that very same staffing model has been put in place by the county within the city as well. So if they're providing staff and personnel at the towns outside of the city, they have committed to saying they have confirmed this, that they are providing us with staff within the city for each one of our sites to confirm that they are doing that equitably, both inside and outside of the city limits. So that's one of the things that we really, again, as the city's chief equity officer, that I wanted to confirm was being done as a protocol of how we would make sure that these things are equitably distributed to the people who need them most. Speaking of equity and access as well, I just want to make sure that you all knew that we're taking those additional steps as well. So all of the signage that we are putting in place, the A-frames that say testing here, etc. We're making sure that even those resources needed for our Spanish-speaking populations, our deaf and hard of hearing populations, we are doing our due diligence to make sure that these resources are accessible to all of our city residents, and doing what we can to make sure that they are very clear on what our position is, making sure that this is for everybody within the city.
Thank you.
Thank you.
Doctor, our next questions will come from Alex Creighton at XXI. Alex?
Good morning. I think we've covered most about everything. Maybe, Doctor, you could just take us through what people can expect when they show up for these tests. I mean, do they stay in their car? I mean, the rapid testing is not the deep nasal swab, right? Just maybe what can they expect when they arrive?
So I would say that we're trying to set up operations so that there is pretty much a standardized approach or a logistics pipeline. There will be partnerships first off, and we appreciate Rochester Police Department for being willing to support us, that will be providing sort of the traffic flow, as we want to have a lot of this be facilitated for those that have the access to use vehicles, so that there is the drive-up option. So a lot of that traffic flow will be, assisted with RPD. They will be guided for those that are registered and those that are not registered to different reporting lanes. For those that need to walk up versus drive up, there will be additional signage and arrows outlining those respective paths for them to do so. As stated, for the most part, we're going to have a large drive-through effort. So these efforts will be conducted in the car. The persons will not have to be outside of the car to get a test. We're actually going to model some of the practices that have been effective over at MCC, which is asking the people within the car until the testing has begun to leave up their windows, so that we're not exposing any of the additional volunteers, but that through certain steps of having signage that says, make sure you have your ID, please leave your window up until advised to do otherwise. And that's just being very clear to make sure that we are putting in protocols that are in compliance with best practices for safety. In addition to that, the test will actually be facilitated car side, so that it could be up to, from what I understand, 4 members in a car who can all receive a test at that one time. We're going to be working with RTS to actually have a hub, if you would, where the test will actually be analyzed immediately after the swab has been conducted. And what we're going to do is that we're going to be providing them sort of the basic information about that, that's already out there. The testing options will be notified or communicated to each recipient within the first 20 minutes of any of those that are positive, as well as providing them the time frame of the 72 hours of when they are negative. So we're going to have the option if there are people who really just want to stay. Although we're not encouraging that, we do understand that's a sensitive desire that people really may want to know at that moment and not have to drive away. But in most scenarios, we're going to ask that people continue to keep moving for the flow and the real large bulk of people that we are expecting to come through. And so it's a similar strategy for those that'll be doing the walk up as well, which is these services will be provided on site, as well as the testing and the analysis of the test will all be done on site at that time.
And are these self-administered tests or no?
These tests, the goal is to have the actual person doing the tests be guided on that procedure of how to do it effectively. So there will be the person and the attendant at the car side who will be walking each of them through that process of effectively administering the swab to self, to where their job as of that point of the staff person will be to collect the swabs, so that the swabs can be analyzed for later notification of the people.
Very good, thank you.
No problem.
Doctor, if you have a moment, Patty Singer from the Minority Reporter had a one more follow-up, or more follow-ups. I apologize. Like that.
Sure, go right ahead, Patty. Go right ahead.
Thanks. So a comment you made earlier, are you suggesting that the same people come back for multiple tests during this testing, or do you want this to be just, at this time, 1 per customer so that more people can be served?
So what I am suggesting, go ahead, I'm sorry, continue.
Can you just clarify what you answered somebody earlier? It was confusing to me. It sounded like you were saying people should come back several times during this testing.
It's not my intent to communicate that they should come back. But if there was a reason, if a person feels like they were exposed after they initially came and got a test and were exposed to someone after that initial test and needed to come back for a specific reason, we don't want to serve as a deterrent that's saying they shouldn't. Also, Patty, as we stated, we're going to be looking at this as a long-term strategy. So if you came in during December, but you decide you want to come back in March, or in January or in February, we want you to feel like you have the opportunity to do so. So yes, so I don't want to deter people who are, specifically those who have frontline positions, who are engaging with large groups of people on a daily basis per potential employment opportunities, to feel that they can't come back after potentially knowing that they may have been exposed even after they had their initial test.
People had told me that the slots in Irondequoit had filled up just within a couple hours. All their slots were gone. You had said there were 200 people signed up for East in 24 hours. Do you feel this is going to be a tougher sell in the city than it has been in the suburban towns that already have their slots booked?
So we definitely, we don't want to discourage people from coming. We are absolutely aware that this is going to be a heavy lift. And we're doing our best to prepare for that now, making sure that we are partnering with many different organizations and entities and personnel to really try to establish a smooth process. And so we do think that obviously the city has a much larger, robust population, and sometimes we have more challenges, socioeconomic in certain areas, certain specific barriers, transportation. And so we're going to have to do more probably than our counterparts within the towns to increase the access and remove some of those barriers. So we want to encourage people to come out testing. And that's why we're having the Monday, Tuesday, Wednesday, and Saturday, 4 days a week for that reason, Patty, but as well as we're moving them around so that if people are not able to make the one on Monday, they can make the one on Tuesday, they can make the one on Wednesday, to make sure that they have the opportunity to have the access to it. And that's what we know we're gonna have to do that during this time because of the sensitive nature of the condition of the city and how we differ from our counterparts in the towns.
Thank you.
No problem.
Just one last thing before we let everybody go. We will send out information regarding the media availability to get footage of the testing on Saturday. And that information will be forthcoming tomorrow. Doctor, thank you for your time today. Greatly appreciate it. And with that, we'll close the press conference. Thank you very much. Take care.
Thank you all. Have a good day.